I came back to my study place because until today there were juniors sitting here because they were having their pre-final exams. I couldn't come here and study. I was studying in my room barely because see my room, what the situation is, I can't sit on the table. My table is full of all the things, books and all. So I have to study on the bed. If I study on the bed, I can't study on the bed because I'll feel so sleepy and I'll sleep. And so this table and this area will be more useful for me, but as my juniors were having exams, they were occupying this and I couldn't come. So now as their exams got over, this area is free, so I came back and reclaimed it. So here I am. I'm currently posted in surgery, and in surgery we have to give viva before taking the case. So while mostly we'll be doing extraction cases, while doing extraction you have to give anesthesia, local anesthesia. So before taking up the case, we have to give viva to our staff so that they'll allot us the case, and they'll ask viva on the particular nerve block which you have to give while giving anesthesia. We should answer, then we'll get this case. So as soon as on the first day I was not prepared, so my chance got skipped. So after that I took up the 2 cases. Technically I should have seen 3, but because I didn't answer, my first chance got skipped, and now I saw 2 cases. One case was root stub case, and one was also grade 3 mobility, and so up to now I did only 3 cases, and in 3 cases all the cases what I did was mandible. I didn't even see one maxilla also, and apparently mandible is the toughest thing to do. So I just wanted to tell about how I felt when I was extracting mandible. Extracting a tooth from the mandible. So my first case was grade 3 mobility. So the grade 3 mobility is when the tooth is so mobile, like it will be there will be so much recession of the tooth, like the tooth will be very mobile. So ma'am told, like the staff who is guiding me at that time, ma'am told like there is no need to give a nerve block, just give an infiltration and just extract it out. So I gave a local infiltration. Local infiltration is a type of local anesthesia technique where a particular region, like if you are removing premolar, you will give a lingual and a buccal, like a buccal side and a lingual side, you will give a local infiltration. Like you will, in that particular area, you will infiltrate that area with the local anesthesia. So it was like that. But the second case also, my second case was root stumps. So root stumps also, they were superficial, they were not deep inside. So ma'am, and they were like very small, and ma'am told you can give a local infiltration and just remove it. I did same for the second case. I did local infiltration and I just removed it. I elevated the flap and then took the periosteal elevator and then removed it. Okay, so it was it. And the both times the same ma'am guided me. So she held the injection and then she made me aspirate, and then she was only holding the pen and then I was giving. So it was like that. So at the time, because ma'am will be like, you only should do, I can't in exam I can't help you, you only should. But I'll look at ma'am, I look like this, and she'll be like, okay, I'll help you, and then she'll come because it's patient, we can't mess up. But so I was like, okay, fine. And the third case, we are not supposed to see the same staff many cases. Like we should cover every staff. Like we have around 6 staff in the department, so we have to cover 6 staff. We cannot repeat on like 7 staff. We can't repeat on same staff for multiple times. So that day case, ma'am only got allotted. Technically, other ma'am told me like allot this to SEM 2. Like I'm SEM 2, allot it to SEM 2. So ma'am was like, I'll allot. No, that ma'am is allotting. And then I went and I stood there for viva near ma'am. Then that ma'am was already taking viva for my before roll number. So ma'am told, you go to ma'am and give viva to ma'am and then take the case. Oh, I was like, okay, fine. And then ma'am asked me IANB, inferior alveolar nerve block. So it is a kind of, it's not that tough, but it is kind of okay. So I went and I gave Viva. I was stuttering because I know I read it just before they are giving. Okay, in this case scenario, what happened is I was least expecting that day I'll get a case. Okay, there were many cases coming, so ma'am was like next. She was skipping. Whoever is not telling, she was skipping. It was like that. So I also thought I was like I should not get skipped. And then I started studying inferior alveolar nerve block. I started studying, and then as soon as I studied, I studied inferior alveolar nerve block, and then what happened? Inferior alveolar nerve block I studied. That only I studied, and then I went to ma'am, and then I answered. She was like, okay, take up the case. I took up the case. I took the case history of the patient, asked for the medical history and all. I arranged the instruments, everything is done. And then I went to ma'am, the same ma'am who took my Viva, and the same ma'am with whom I saw previous cases. She's like, I am about to leave. It was around 12 o'clock. And she's like, I am about to leave. You ask any other staff. So there was one sir, okay. That sir will help you, like to give it, every step will help you to give. But Viva, very tough. Like after taking up the case, we have to give Viva for the case history which we do. So very tough. There was other ma'am. She is also very tough. But at least she won't like terrifying. Maybe I can tell. She's not like, for looking at her, she's not that terrifying. She's so sweet. She'll help you if you not. So I went to that ma'am and I was like, ma'am, I got the case and I gave Viva to ma'am. Ma'am told me to take up, but ma'am told she's leaving, so she told me to show for others. So then that ma'am was like, okay, I'll come and I'll see her, because she was seeing my friend roll number. Like I am 95, so 94 roll numbers case she is also seeing. So she was seeing. I went and I was like standing here, please, because this is my first time giving a nerve block. So I gave a nerve block. I didn't give a nerve block technically. So while giving, see, for how inferior alveolar nerve block, you should give somewhere here back peripherally. So this inferior alveolar nerve block completely covers this side. So she came, she stood, and she's like, have you ever given inferior alveolar nerve block? I was like, and she's like, okay, we can give, come. And she was like, I was like, ma'am, I'm afraid. And then she told me, in OMFS, this word should never come. Like she told, in surgery department, you should never tell you are afraid. You have to do that. And she was like, she clearly saw it on my face, and she's like, you cannot be so afraid, Aisha. So she's like, if you're afraid also, you should not show it before patient. Patient will get afraid of, because what she was telling is 100%. But in my this least common sense time, I'm like, bro, what if I do any harm to patient or anything? I cannot do that, right? I cannot do a mistake. And she's like, you can have doubts, but you should not be afraid. Ma'am was like giving me, and the patient, my patient is 65 years old, and that amma is like, it's okay, I'm not afraid. She is giving me like mental support, like you can do. She's like that, but I was so afraid. So technically my patient has a medical history of diabetes for past 3 years, and she's under medication, and she's also have history of cholesterol, and she also have history of skin allergy. So now the main consideration is diabetes. So if the patient is diabetic, there may be high chances, like if anything happens, the patient can get a medical emergency on the dental side. It's like syncope. The patient can lose his or her consciousness suddenly if the sugar levels go up and down. Okay, we are giving LA, local anesthesia. It is leucovorin with adrenaline. Okay, adrenaline have this what you will tell us, have this capacity of increasing glucose level or spiking up the glucose in the body. So if it spikes up, if something happens, it was like, I was afraid, because diabetes patients is generally immunocompromised patients, and this and all, it was going on, and I'm like, oh god, now that as well as there's this fact, okay, as soon as if a patient comes and we start taking history, it's not like we don't want to treat, it's not like we don't want to take up the case, it's not like we don't want to operate. It's just the question that follows as a student. When we take up the case, our staff will obviously ask us question to make us learn. It is for us to make us learn and it's for us to gain the knowledge, but there will be some or other point in us, like some or other way in us, like, bro, we are going to get these systematic questions, that questions. She'll ask me how to manage a diabetic patient, how to manage the asthma patient, how to manage a thyroid patient, like whatever the medical history patient have, she'll ask. Because as a dental student, we have to know how to manage an emergency in a dental clinic, so she'll ask us. But as a student mindset, you can understand, like, bro, again she's asking, I can't. It is like that. But as a learner point of view, it will be very interesting. It's like, yeah, I know. It's like you will be like, okay, fine, I can understand. I learned a new thing today, and I'll be very happy if I gain new information. But how to tell? When it is told, and when they ask us, we search somewhere, we search in the textbook, we go there and all. The thing is, we'll be ready to accept new information. But if the case didn't get signed, our quota won't complete. This will be the main concern of the students mostly. Am I offending anyone? Sorry if I offended anything, but this is what I feel because of how the rush things will be. So I feel like that quota will be the main thing. But yeah, besides quota, it also feels so good that, okay, I saw a diabetic patient today, and I saw this case of because my second RS was root stump case was infected root stumps. So I got to see that they'll do saline drainage with the betadine drainage and all. So I got to see, and my other friends, other batchmates who and all did the cases, they also saw some techniques, transalveolar extraction, some extraction cases that came to us, third molar extraction cases that couldn't be done by us. So in the middle of the process, it got transferred to the PG or someone. PG. So PGs, when they are doing transalveolar extraction, we will be assisting them. It was a nice thing to learn a new thing, but at the same time, the quota thing. So it is like, yes. So what I was telling, so inferior alveolar nerve block. I was about to give inferior alveolar block. So I was visibly shaking. So not my hands are visibly shaking. So I was like, I held the syringe, and then I was like, legit like this. My hand was legit like this. So I was giving, and then ma'am was like, do you know how to do? Then I told the theory, like, we should take our thumb and we should take an index finger, and then we should palpate here, and then we should palpate the coronoid notch, and from coronoid notch, that point, pterygomandibular raphe, and then from pterygomandibular raphe we should go 3/4 behind, and that intersecting point. I told the theory, and she's like, okay, can you palpate and show? I'm like, sorry. And then she came, she showed me how to palpate, and like syringe cap will be there. No, she didn't take off the cap, and she kept the cap, and then she was like, okay, she showed me where and all we should palpate and all. She palpated, and then she kept it, and then she gave it. So I was like, okay, fine. I did okay, and then I was like, my hand was visibly shaking. So ma'am held my hand, and then she guided me. Okay, I actually guided her. First I pointed it there, and I was afraid to inject. Maybe if I didn't hit the bone, if I hit the soft tissue, and I have to remove that again, and I was thinking many things in my mind. So my hand was visibly shaking. So ma'am guided me, and then she made me slowly. She asked me to hold it like this, and then she asked me to aspirate. So I aspirated negative, no blood was there. So she told me to slowly inject. I slowly injected around 1 ml, 1.2 ml I injected. So she told, now slowly withdraw the needle to 1 ml. Okay. So when I was withdrawing, I slightly disoriented it. So ma'am again took my syringe, and she oriented it. Okay, she oriented it, and then I gave 0.2 ml of lingual nerve. Okay. She told withdraw 1 centimeter and give. And then I gave. After that she asked me why we are doing this. She asked why are we withdrawing and we are giving this. So I was like, I know for sure it was for to anesthetize lingual nerve. But in my mind I'll be like, God, what if I'm wrong? God, what if I'm wrong? So I'll be like, lingual nerve. And she's like, yes, correct only, lingual nerve. In OMFS you should be very dare to tell the answer. Even if it is wrong, we are here to correct. You cannot admit the defeat like, no, I am wrong. You once have to try, then only you'll know. So I was like, okay ma'am. And then she told me to give buccal now. She asked me why we will give long buccal. We told ma'am to anesthetize the posterior mostly, then the pulvar region and all. Okay, she told me to, you're answering, no, give like that. I injected, and then I was giving buccal, and then suddenly at least in inferior nerve, ma'am told me, like ma'am made me orient, and then ma'am told me to inject and all. Even then I was afraid that if I did, when I aspirated, I remember aspirating it nice, but that in my mind it was like, oh God, I didn't aspirate properly. Without aspiration only I gave. What if I gave in soft tissue? Okay, if you give it anesthesia and soft tissue, there will be there may chance, if we prick the blood vessels or anything, there may be chance of getting a hematoma. So I was afraid, and then I gave it, I inserted in the soft tissue in buccal. So I gave it in the buccal region, posterior most teeth. We have to give it there. So I was giving, and then suddenly, before giving, my hand just started shivering. It's like, bro. It was so shivering that I thought I'll prick it here. My friends thought I'll prick it here. So on the lip. And then I just took, and then ma'am held me, and then she's like, slowly she took it, and then she placed it, and then I started giving LA. As soon as I started giving LA, what happened was like, I started, and then suddenly the needle came off because my hand was shivering so bad. And my friends later told that ma'am was laughing seeing you eyes up because she saw you were so much tense. And then I kept it there, and then when slightly retracted, what happened was blood started coming, like lighter blood started coming. So I was like, ma'am, blood is coming. And then she's like, it's okay, you pricked in a soft tissue region for giving buccal, so it's fine, blood will come. I was like, okay ma'am. I was like that, and that's how I gave buccal. And then she started asking, she started to ask, like she told me, ma'am told me to ask subjective and objective findings. So I asked the patient, is it paining or is it a tingling in sensation, or do you feel numb over here and all? I asked, and all that. Everything is done. When I was extracting, for it. It was so hard. I was unable to move it. So it was very hard. And that too, it was lingually placed. First I elevated the flap there, and then I kept the instrument, and then I removed it. I didn't remove, I moved it, and I luxated the tooth, and then ma'am made me place the teeth, and then place the forceps there, and she asked me to extend. I tried. I made it luxate, that's it. I was unable to remove it because I didn't have that much strength. Okay? And second one, 4-8, the last teeth I did, 4-7 also, it was indicated for extraction. So I luxate. First was, I was afraid 4-8, but 4-7 I started. I did. Suddenly I did like this, blood started oozing out. I'm like, bro, blood started oozing out. And then ma'am was like, move. And then I almost got it up, and then the blood started oozing out. So she asked me, what are the, ma'am asked me is she on any blood thinners, or she's on any or the anticoagulants or anything. So I told, no ma'am, she's just under medication for diabetes. So I told, and ma'am was like, okay fine. And then she as my patient was closing her eyes, and ma'am placed a ma'am made we'll have gauze, so 2 to 3 gauzes ma'am folded, and she asked the patient to bite. This is how we'll give a pressure pack so that the bleeding will stop. So ma'am told me after 5 minutes. So what happened was, I gave, and then she asked me the questions, I gave it. So after that, I was standing, and then ma'am asked to get a concentrated glucose solution for the patient because patient was closing her eyes and she's diabetic. So ma'am told, let's like give, and the blood oozed out so much. So ma'am told, let's give some glucose. So she got. If she was feeling any dizzy, she was not feeling dizzy. She was sleeping. So that's different from feeling dizzy. So ma'am kept the concentration, and that patient told ma'am, he like, I don't need glucose. Give her the glucose. Her in the sense me. She told me that he like, you are only she's only telling that you are about to faint. You should not show it on the face. Use it first. Because I was so tensed up because it is my first IANB, and that ma'am is very knowledgeable. And if you, I was somewhere or other afraid, but I answered my viva and I got the case. But somewhere or other inside I was afraid like, bro, if I don't answer in middle of the case, she'll cancel my case, I'll lose my turn, I won't get a chance to do case. This was all running in my mind. So yeah, that's why I was so afraid. That's why my patient told me to take the glucose water and gain that strength, and instead of her. I was like, okay bro. And then that day my friend got one more patient, and she was coming for complete denture. Her all tooth are removed, only two tooth are left. 4445 was left for her to remove. And then she was like sitting on the chair. As a general patient prep talk, will tell, it's okay, it won't be that pain. Do you feel any do you feel dizzy or something? I just asked, it's okay, don't pain that much and all. I was telling the patient, and then my friend saw me like, don't tell. And I told casually, and then she's like, I know, because my all tooth are removed. There's only two tooth that is left. I'm like, bro, why am I getting embarrassed by patients today? I felt like that day, and then I'm like, yes, okay, fine. So that's how I got my first IANB experience, inferior nerve block experience, and how my patient told me to take glucose instead of her. So I'll tell one more time. I'll tell any more interesting stories that happens like this on my channel. Do follow.